Seasonal affective disorder is considered a depressive disorder, so a subtype of major depression with seasonal changes. So what that means is it typically onsets in the autumn, lasting through the winter months, and then improving in the spring. Probably about 5% of Americans experience seasonal affective disorder. Women are 4 times more likely to experience it, and then those living in the northern states, such as the Pacific Northwest, Alaska, and New England, tend to experience it more. Seasonal affective disorder is different than major depression in that it's the specific onset, and it's a pretty typical pattern of onset. So autumn through the winter and then improving in the springtime, we're experiencing these cluster of major symptoms. And so we may have changes in appetite, weight gain. In regards to appetite, carbohydrate cravings and sugar cravings tend to be more increased with seasonal affective disorder. Additionally, with decreased physical activity, sleeping, hypersomnia, where you feel like you got a good amount of sleep, but still waking up feeling tired and lethargic throughout the day. And then also, our thinking, concentrating, and how we feel. It's kind of maybe slowed or not typically how we feel throughout the year. If we think about a very severe onset, we may experience hopelessness, worthlessness, and thoughts of suicide. And in that case, we really want to make sure we have a plan for support and treatment and crisis resources. So major depression with seasonal changes, which we consider seasonal affective disorder, meeting criteria for changes in your thinking, your daily functioning, like going to work, going to social occasions, events, how we feel emotionally and physically. So to meet the diagnosis, we really do have to feel a decline and a decompensation in all those areas. And it's important to get evaluated for such. So when a patient comes to see me for an assessment or an evaluation that they're feeling, having mood changes, experience some decline in functioning, they're not just feeling themselves, I mainly encourage them to get a medical exam because we want to make sure there's not any other underlying medical conditions that can contribute to weight gain, sleep, difficulty thinking. There's a lot of comorbidity conditions that could be impacting them. And then we also look at evaluating, all the areas of their life. Let's look at the typical onset with seasonal affective disorder. Are they noticing a change in their mood, functioning, thinking, and how they're feeling at specific times? And most people can pinpoint that, especially with the change in daylight savings time. So if you've been diagnosed with S.A.D and had seen a medical professional, your treatment plan may include a combination of light therapy, vitamin D supplementation, medication possibly, and cognitive behavioral therapy, which is evidence-based treatment for seasonal affective disorder and depressive disorders. Self-care is really key with S.A.D because it tends to take on a predictable pattern, which means we can really implement prevention in anticipation to thinking when our symptoms may onset in a more severe way. So make sure to get outside, to have that pattern or that habit or daily ritual of taking a walk. That's a big one. Being able to, obviously make the nutritional changes, having that vitamin D in what we eat is really important. So consulting with the nutritionist or your physician on what you should target specifically in your diet and maybe increase in anticipation for this. Being able to plan pleasurable activities and being able to stay to those commitments, because once S.A.D onsets, we're more likely to onset and we're not going to want to. We may, find ourselves canceling plans or wanting to cancel. So being able to commit to those plans, stick to that commitment, because once we do get out and get social, we start to feel better. Exercise, I would say exercise is shown to be a physical activity and movement. Doesn't have to be rigorous. I think getting your body moving, being able to really connect with others. If your exercise is connected to a class or a group, you're kind of hitting both. You're getting your exercise and you're getting your social connection. And being able to reach out to your support network, letting your friends and family know how this change affects you with the season so they can also check in on you, hold you accountable to your commitments, and support you. So I would say the winter blues are considered, intermittently. We may feel sad, we may want to stay home, but we're still watching our shows that we like, or we're just like, hey, I just want to hunker down and be inside and not be around others. And then maybe the next day you're able to go out and engage or talk with your colleagues or coworkers. So you're still engaging, but maybe pulling back a little bit, like the winter blues or feeling sad. Related maybe to some external stressor, like experiencing loss during the holidays is hard, but it's something external. Whereas seasonal affective disorder is very much a pervasive pattern where you see globally you're losing interest in things. You're losing interest. You stay home, but you don't want to watch your shows. You don't want to eat your comfort foods. You just kind of withdraw from life on a global scale. I think what's tricky about seasonal affective disorder is it does get better. You see it remit in the springtime. And so people may not seek treatment. They may not consider it something more serious because we also make it synonymous with the winter blues, which sounds very lighthearted. But if you consider seasonal affective disorder being a major depression with seasonal patterns, which is what the official diagnosis is, it sounds more serious than just the winter blues. So I think having people to consider the seriousness of their symptoms and that it certainly can get better with treatment. A lot of good research, a lot of good support out there, evidence-based support for it to be treatable.